Get ready as we scrub in and dive deep into the question of what is your why? We'll explore personal stories, practical lessons, insights into innovation, health education, and more.
Join us as we talk with doctors, healthcare professionals, and community members to learn why they chose healing, hope, and humanity.
All right, everybody, welcome back to Season 3 of Scrub In.
Yeah.
3 seasons in.
Episode 1. Woo!
Episode 1 of Season 3, everybody. Thank you for joining us again for a third season of wonderful conversation.
Yeah. We're going to start with our quote, and today that is, "Not all angels have wings. Some have scrubs."
That's
and
so true.
We don't know the author of that, but
Yep, that's an unknown author.
That's
but
a great one.
Good point to make.
I agree.
Today we have Christopher Otto. He is the Executive Director of the Delaware Nurses Association. So we're very happy to have you, Chris, here with us today. Welcome.
Yeah, welcome.
Awesome. Thank you. So excited to be here. Absolutely love the podcast and everything you've been talking about.
Oh, thank you. I know we've been trying to get you on for at least 2 seasons, so I'm excited that you're here.
Yes, the stars and schedules aligned.
Yeah. So tell us about yourself.
I am a registered nurse in the state of Delaware, nearly a Delawarean. I was born in Philadelphia, but raised in Delaware. Have been a nurse for the past 14 years, almost 15.
Okay.
All Delaware educated, Delaware Technical Community College, Wilmington University, and then I did go up to Drexel University for my master's. Clinical-wise and career-wise, I have been in adult nursing, did cardiovascular, stepped down, and then moved into cardiovascular intensive care. Got my hands involved in shared governance and absolutely love that. So I say I grew up in shared governance as far as leadership, development, advocacy. So that's a big part of my history and my nursing career. Opportunity knocked, and I was able to take a full-time position working on nursing professional excellence, magnet recognition, continue to do what I love with shared governance. And then another opportunity knocked in the wake of the pandemic. I had been involved with the Delaware Nurses Association for many years on committees and boards, and then 2020, the opportunity arose to transition into employment with the association, and officially as of January 1st, 2021, I have been the executive director.
That's awesome.
Yeah, a lot goes into that role, but I absolutely love it and ended up where I was supposed to be.
Yeah. Now, backtracking a little bit for some of our listeners who don't know, what is shared governance?
Yes, shared governance is, I'm going to give the very business answer to that, but it is decentralized leadership, empowering nurses and other professionals at the front line to identify problems, be a part of the solution, continue to stay engaged, monitor the progress, track outcomes, and really just overall improve the work environment, the quality of care, and build their leadership skills.
Yeah, so they actually make some of the hospital decisions and have a hand in leadership and making decisions directly from the bedside, right?
Yep.
Something like that.
Absolutely. They are partnered up directly with, the organizational leaders, whether it's at a unit level, a department level, system level. Within shared governance, you have that organization as well. And so I was able to get partnered up and receive some expert mentoring from some great leaders to really help further define and expand those skills that I learned starting at the unit level.
Yeah.
That's awesome. I remember my experiences in shared governance, and it was all about establishing a really healthy work environment.
Yeah.
So many different decisions were made by, a collection of individuals, and it really changed the way that we came to work and felt every day.
Exactly.
So,
well, and I think so many professions don't have the opportunity to have a voice in the decision making, and although I think a lot of professions are moving that direction. I remember in one of our episodes that we interviewed our hospital CEO, Terry Murphy. He was talking about that is something that's growing in the business world as well, that people are empowered to help with the decision making for companies and things like that as well. So, of course, nurses started it.
Exactly. Yes, that's been around for decades.
Yeah. And with that, what does DNA, or the Delaware Nurses Association, what does DNA do for nurses here in Delaware?
That's my favorite question.
Oh, good.
Something I have gotten used to talking about over the last couple of years. We are the largest, oldest, and most inclusive professional association for all Delaware nurses. Our membership comprises individual nurses, licensed practical registered, and advanced practice registered nurses from across the state. Doesn't matter where you practice. And our role is to be at the state level primarily. We also work with organizationals and nationally through the American Nurses Association.
Sure.
But our number one focus is ensuring nurses are represented, included, advocating, and known at the state level. That is in government, that is in leadership, that is each other. Building a community of nurses across the state and, opening those doors. So
That's awesome.
What we do in a nutshell.
Yeah, that's awesome. And one thing that we always ask on this show is why you do what you do and what inspired you to get to this point. And so I ask you, what is your why?
Yeah, I love starting with the why. I don't know if Simon Sinek is. Are you familiar with him?
Oh, yes.
Book featured by him.
Yes.
Yep, you got to start with the why in everything that you do. So was exposed to him through one of my mentors. And have been connected to my why and continue to reconnect with my why a lot. For me, it is that personal connection, the ability to, identify and connect with someone, recognize, what they're going through, and be in a position to help them through it, to, support them. That's in the generalist sense, but, as an ICU nurse, I, recognize cardiovascular changes, neurological changes, and respond and intervene in the very medical and technical sense. But what I absolutely love to do in my why is just the whole person.
Okay.
Learning about all aspects, building that relationship, and then seeing how I can help and support them along their journey.
Yeah. Now, what led you to nursing?
It was actually a bit of an accident.
Okay. We've had quite a few people that have said that.
Yeah. Talking to nurses, you've talked to a lot of them. Normally it's, someone in their family or they've had an experience. None of the above for me. No nurses in my family. I was actually taking drafting classes in high school, was going to look at schools for architecture. That was, what I wanted to do. I took a job during my senior year of high school as a patient escort. It was not something I was particularly interested in, but, connections, and I ended up there. And through talking with the patients, watching the nurses work with the patients, I said, wow, that is something I really feel connected to, drawn towards. So I explored it further. I applied and took a patient care technician job, got a little more hands-on, and knew at that moment that aspect of support and healing was just a natural fit for me. And so I say it happened by accident because it was not on my radar, but once I fell into it in that environment, the rest was history.
That's awesome. I do think that your architectural mind, though, I'm sure benefits you in your problem-solving skills as a nurse. We are all excellent problem solvers, and I can only imagine that level of thinking probably comes in play every once in a while still to this day.
Absolutely. Even with the association and everything we're doing there, I still joke, but I'm very serious that I have a Donna Beatty mind. I have to start with the structure first. I have to put the infrastructure in first. I can't do anything else process-wise or, programmatic-wise until it's like, okay, who's doing what?
Right.
What committee, what stakeholders do I need, build the scaffolding.
Yeah. I can imagine a lot of organization is needed in that role.
Yes.
Definitely.
Yep.
Yeah.
Perfect for your background.
Yes.
Yeah, that's awesome.
Yep.
Now, what do you do when you're not working clinically or for DNA? What do you do on your weekends and time off?
My other favorite role is to be an uncle. So I spend a lot of time with my nieces and nephew, my family, my sister. We go to concerts, we go to the beach, we do park trips. I'm also a proud dad dog, so I rescued one recently.
That's awesome.
Back in July, and so we're still getting her acquainted and all the trips and everything there. Spent a lot of time with friends. So
nice.
Yeah,
what kind of dog did you get?
She is a mix. Definitely spaniel. We're not sure what else, but I just learned that you can actually get a DNA test for
Not a doggy
yeah.
DNA
a
test.
doggy DNA test
Okay.
and figure out exactly what kind of breed they are. So
Wow, that's so cool.
There you go.
I think I'm going to do that.
All right.
Yeah.
I have a Basset Lab mix. So he's a yellow lab on short legs.
Oh, my goodness.
And rescue dogs are just the best.
They're the best.
They love you so much.
Yep. Oh, I have some dog hair on me because after being
Same.
away from her for the last 4 days, I couldn't not come down here and stop and get her at my sister's. So I
Yeah.
got lots of love after being away for 4 or 5 days.
Yeah. And you were in DC, right?
Yes.
You spend a lot of time in DC. I follow you on LinkedIn, and you are in DC a lot. So what in your role takes you to DC?
Yeah, that is part of our national focus of the Delaware Nurses Association. So we are the state affiliate of the American Nurses Association, second largest nursing association, 1896. And so when I'm going to DC, most often I'm going to represent Delaware nurses at national forums, either within ANA or some of the partners.
Okay.
So, for example, on Monday and Tuesday, I was there working on behalf of the Alliance of Nurses for Healthy Environments. And we partner with them regularly at the state level. They're partnered up nationally to educate and engage and advocate for nurses in that environmental climate change space. So I got to meet with representatives from the White House Council on Environmental Quality, where we talked about extreme heat and the impact on health of individuals, different populations, how it's exacerbating with climate change in different parts of the country. And then we got to meet with the EPA, the Environmental Protection Agency, the next day to continue those conversations. Wow. From there, I spent the following 2 days with my colleagues from the other state nursing associations and the American Nurses Association for the lobbyist meeting.
Oh, okay.
Yeah, policy and politics, not a favorite topic within nursing, but something that I am passionate about and know a lot of other nurses are passionate about. So we come together once a year and talk about all the policy priorities, what states are doing what's moving at the federal level, what's not moving at the federal level, where nurses are engaged, where we should be and are not currently, and sharing those solutions and best practices from other states.
Oh, that's awesome.
Yeah.
Can you share any of the highlights from that and what you discovered while you were there?
Yeah, absolutely. I'm thinking of this long laundry list we created.
Sure, absolutely.
And I'm like, what do I pull from? Of the emerging issues in nursing and healthcare was the activity, and we ended up with well over 30 topics.
Wow. Okay.
I mean, everything from gun violence pandemic to workplace violence and staffing, some of the evergreen issues that we're always talking about. So one that came up was some strategies around workplace violence that states are doing at that level to put into place regulations, with certain requirements around committees, education, public awareness, and engagement around the problem.
Yeah, that is a growing issue.
Yes.
And here in Delaware, it is now a felony to attack a healthcare worker, but which is great advances, or it's a great advance in that. But I'm sure there's still so much work to be done.
Yeah, a lot of work to do from there. That strategy is important, although it doesn't prevent the workplace violence from happening. It is a more punitive measure once it's occurred. And that's something I spend a lot of time talking to nurses about in the state, is around that in particular. And, overcoming the fears and challenges of reporting those incidences, working with local police agencies on collecting the information, the reporting aspect of that, and then even had the fortunate opportunity, but unfortunate for the nurse, to support her directly as she engaged with our judicial system, the legal, actually supporting her while she went to court and, things were being charged and processed. at what point she needed to provide a victim statement from the assault she experienced. Most nurses didn't know from that experience that if you don't show up when you're called to court, that case just gets dismissed in Delaware. So you make childcare issues, work issues, you can't get out, but not recognizing that if you don't have the support to rearrange and prioritize getting to that court when summoned, unfortunately that case will just get dismissed without any action.
Yeah. And I know even here at Bay Health, some of the nurses that I've spoken with who have experienced assaults, a lot of them don't want to report them because their name gets put on the police report, and then that person could potentially come find them. Or
I can think of people in my head right now, people that I've worked with that
Absolutely.
have experienced it, and they've left the profession because of situations like that.
Yeah.
So it's great to have a voice.
Yeah, now that's what we're helping to do, is provide that voice, the awareness, understanding of all the dynamics of that, and letting nurses know that it's okay and it's important to do these things because of all the downstream impacts that it has, starting with that report. And it's something that I continue to advocate for in expansions. So for example, there were some recent legislative changes around nurses are mandatory reporters. We have that mandatory as long as, as well as physicians and others, to report certain things to the state. And that's, an impaired, yourself is impaired from substance abuse, a colleague, and then most notably, any suspected or known child abuse, elder abuse, abuse of other vulnerable populations. And so the state is expanding that and refine some of the requirements for how and when mandatory reporters have to report that child abuse. And one of the things that they did was they ensured that the reporter is not has to provide their information on that child abuse report. They have to report, who I am, where I live, where I work, some of those details. And we questioned that with the state and with the Child Protection Accountability Commission. And what we learned was the difference between the confidentiality and the anonymity. So you are not confidential to the state, to the system, but you are anonymous to the public. And that was what we advocated for, to ensure that the nurse's personal information is not going to get out into the hands of the public, and potentially even those that they're making the report against. So that's one of the ways, many ways we advocate for nurses is to ensure that their confidentiality, their privacy is maintained.
Was there anything innovative that other states are doing that was surprising or interesting to you, or are we all kind of working on the same thing?
We're in the same boats there. I think we have some opportunity in Delaware to bring more safe harbor laws into place that add another layer of support and protection for those that are actually, reporting concerns, abuse or other workplace concerns. So there are things, little pearls that, learned from my colleagues and we'll bring back to the state. Our priority for next year around workplace violence is really better understanding the data at the state level. As nurses, I follow the ADPI process in this role as well. I have to assess the problem first before I diagnose. So we're really looking at how we can define in statute a minimum data set of workplace violence, that has to be collected. So there's been an incident. Who was involved? What was their role? What was the outcome? Was it reported or not? Where did it occur? What kind of violence was it? We know the difference between physical and verbal assaults. And then at some frequency, organizations collecting that and reporting it up to the state level, de-identified. We don't need to know protected information, but we do want to know at the state level, where is it happening? How often is it happening? Who's involved most frequently? And across settings, acute care, long-term care, home health, state facilities, private institutions, all the areas that schools, all the areas that nurses are working in, so that we can then have that trended and aggregated data over time to really dive into the issues further and begin putting solutions in place. So that's what we're going to be looking at.
That's awesome.
Yeah.
I would also be curious to know if there was any difference between like licensure. Is it more common in, I don't know, LPNs versus APRNs or something like that? If, to be able to target interventions for specific areas and, to improve that further. But that's great. Here at Bay Health, we've been working really hard on staff wellness. And we, in fact, just did our second training for a program that we're going to be doing for peer support, so that when we have staff, clinicians who are having a hard time, they can call and a peer responder will be able to meet with them quickly and talk to them, just listen about what's going on, so that fear and all that stuff that we carry from either an assault or a code or some sort of, maybe something at home, is not affecting our care. And so we're excited to be starting to roll that out. It actually rolled out yesterday.
Awesome.
And so, but that all is along that same line. I think we came out of the pandemic realizing just how important wellness and protecting nurses and doctors and clinicians really is. I'm
in some forums where we talk a lot about staffing and workforce, and I'm recalling a meeting in particular where there was a lot of focus on, moving patients and care from an acute care setting to the community, to providing care where patients are, and increasing access and that support. And at that time, there had just been a home health nurse from Connecticut or Massachusetts that unfortunately had been murdered by a patient. And so I was the voice in the room to say, yes, absolutely, we need to move care to where patients in the community are, increase access, increase equity there. However, we also have to at the same time prioritize the safety and well-being of the workforce that's going to be in those settings, because you will never be able to increase the capacity in those communities unless you have the workforce to actually be there. And one of the reasons we know nurses and other healthcare professionals are leaving or choosing different employment settings is because of experiences with violence and other issues. So
that's not awesome, but it's awesome. The work that you're doing is awesome. I was just about to say, oh, that's awesome. But
the fact that voices are being heard is the best part.
Exactly. I agree. Yeah. And really, when you're not in the hospital or you're not paying attention to that data and to, those stories from people at the bedside, you don't realize just how many clinicians are affected. Exactly. And I know I had been in academia and then came back to the hospital and was shocked to hear some of the numbers and how much that had increased over the past few years. So absolutely. So I understand I hijacked the conversation and asked you about what you were doing in DC, but what are you passionate about in what you do out in the community? Because DNA is such a big part of the community, whether the community realizes it or not. What are some of the projects that you're really passionate about here in Delaware?
I absolutely love to provide meaningful or facilitate meaningful recognition for nurses across the state. So talking about community engagement and partnering there, another way that we keep and retain a satisfied and well workforce is by providing them meaningful recognition when they are doing what feels like simple, mundane daily tasks to them, but to the patients and communities we care for are life-changing. So at the state level, I just launched a committee yesterday on recognition, and we were going to expand our opportunities. But one of the things that I know Bay Health has been a leader in for years and Delaware Nurses Association has adopted is the partnership with the Daisy Foundation.
Sure.
So we have developed an innovative relationship with them where we now ensure any nurse working in the state of Delaware is eligible to become a Daisy honoree, whether through their direct employer like Bay Health or through us. So we awarded last year some school nurses, some public health nurses working for the state,
Oh, awesome.
a psych mental health nurse that was in independent practice.
Great.
So really partnering with the community to uplift those stories and provide them back to the nurses is something that I just love facilitating.
That's awesome. And those are patients that nominate nurses, correct?
Yes. I distinctly remember a nurse midwife from a state facility that had, I think, 5 or 6 nominations from her patients.
Wow.
What an impact.
Yeah, talking about the impact that that midwife had on her patients and her kids.
Nurse midwives are amazing.
They are.
Spoken from a fellow nurse midwife over here.
And so how would patients out in the community nominate? Obviously, we have signs all throughout the hospital, and most of the
Yes.
hospitals in Delaware do, but how would a patient out in the community nominate one of their, like a school nurse or something like that?
Absolutely. We continue to raise awareness in a number of venues for that. We have advertised in local journals, the Women's Journal and others, to really get the message out there. And we partner with those employers that are, employing those nurses, the state, the
Okay.
home health agencies, and long-term care agencies, to get some of those materials out there. Actually doing a webinar for them next week to really talk about the specifics of that. But otherwise, we have a website,
Okay.
denurses.org/Daisy, and you
Okay.
can get in there and submit a nomination. Very easy. Any nurse working in the state of Delaware.
That's awesome.
Yeah.
Oh, I had seen your marketing campaigns around it, but didn't quite understand just how much that expands that recognition throughout the state. That's awesome.
Yeah. Yeah,
Cool.
absolutely.
What else do you do in the community?
Um,
What else?
What more could you possibly do?
exactly.
I know.
What else in the community?
You do a lot with the LGBTQ plus community, correct?
Yeah. I had to thank you for reframing that. I was very stuck in my DNA hat, but yes. Personally, supporting the LGBTQ community through advocacy, getting out there at our annual Pride event in Dover, showing up in force, also getting involved with that politically, and supporting the Pride Caucus and other groups out there that are really championing the issues and educating legislators, and also putting legislators in place that understand and are either part of the community or really connected to the community. And one of the things we were able to do legislatively was put some protections in place for healthcare providers around gender-affirming care and other aspects. So, get to blend my personal and professional roles in that sense to really advance those issues.
Yeah, that was great legislation. That was heard right before House Bill 350 when we were in the House. So those of us who were there to support that bill or against that bill, got to listen to the hearing about the other one. So that's awesome that passed.
Yes.
So
Yep.
great, awesome. Well, we're getting to the end of our time together. Is there anything else you want to share? Anything about yourself or DNA that you want to share with our community?
I think professionally speaking, a concept that I'm loving and that I want to get out for all healthcare professionals is really around embracing your personal and professional identities. The recognizing that we all come to the table with our personal experiences and values, and that we begin to blend that through our education experience as licensed healthcare professionals, and how they continue to merge together, and we continue to cultivate them through our organizational, state, other engagement points. And so for the Delaware Nurses Association, it's really important for us to understand, connect with, and elevate the nurses across the state that are working in various different settings and embracing that role, wanting to champion causes. We find ourselves in spaces that I never knew we would be in.
Absolutely.
Like, environmental, we supported the campaign for paid family and medical leave in the state that was approved. So recognizing social determinants and getting involved in those spaces. Delaware Nurses Association is here for you and can be that platform to get nurses educated, engaged, and confident in that identity. And,
That's awesome. That's great. Yeah, that's a big part of why we started doing this podcast, is because we knew that there were healthcare professionals that maybe weren't in the space they originally sought out, and they have backgrounds from all different places, and we wanted to hear about that from other people and understand that we all have a common cause, and a lot of our whys are very similar, but they are different, and it's so cool to bring us all together. So yeah, that's a great place to end.
There is room for everyone at that table.
Absolutely.
And we want people, nurses, healthcare professionals, to bring their authentic selves.
Agreed. I agree. Yeah.
Especially in times where, we have a lot of different views and opinions. DNA is a space where we welcome the diversity in thought and experiences.
Awesome.
Perfect.
Well, Chris, thank you so much for coming. This was a great interview. I hope you felt like it went okay.
Absolutely. I mean, I feel like we need more time.
I know.
There's more I would love to talk about.
Yes.
But yeah.
Thank you for sharing all of this information
Yes,
about
thank
what
you
you do.
so much.
Yes,
we
absolutely.
appreciate it. Thanks for joining us on Scrub In, a podcast on humans, heroes, and healthcare. If you enjoyed this episode, be sure to subscribe and follow us wherever you listen so you don't miss what's next.
Please leave us a review, tell a friend, and come scrubbing with us next time.